Most sciatica is not a diagnosis. It is a symptom pattern. It tells us pain, burning, tingling, numbness, or an electric feeling is traveling somewhere through the butt, hip, or leg. But it does not tell us why. That matters because the butt is a crossroads. Nerve pain, tendon pain, hip joint pain, deep glute irritation, and low back referral can all meet there and pretend to be the same problem. And if we pick the wrong fix, we can make the angry thing angrier. Stretching nerve pain harder is like pulling on a phone charger because the Wi-Fi is slow. It feels like we are doing something, but the problem may not be where we think it is. So today we are sorting the bucket first, then building a safe 10-minute starter plan that does not flare things up. But before any exercise, red flags. Get urgent medical evaluation if you have new bowel or bladder problems, trouble starting urination, numbness in the saddle area, new sexual dysfunction, rapidly worsening leg weakness, foot drop, symptoms down both legs, fever, unexplained weight loss, history of cancer, major trauma, or severe pain after a fall. If you cannot bear weight, have severe groin pain after trauma, have symptoms spreading down the leg despite backing off, or weakness is getting worse, do not try to solve it with YouTube stretches. That is not fear, that is good sorting. Now, if there are no red flags, we move to the 5 buckets. Bucket 1 is true nerve or nerve root irritation. This is the classic sciatica-like lane. Pain shoots below the knee, burning or electric quality, numbness, tingling, leg pain worse than back pain, symptoms worsened by coughing, sneezing, or straining, or actual weakness. For this bucket, aggressive hamstring or glute stretching can backfire. Nerves usually like calm movement, walking that does not worsen symptoms, and gentle sliders if tolerated. If an exercise makes symptoms travel farther down the leg, that is not progress. That is the nervous system saying please unsubscribe. Bucket 2 is deep gluteal or piriformis-like irritation. This is often buttock-dominant pain that worsens with prolonged sitting, car rides, getting out of a chair, or certain hip positions. But piriformis is not the default answer for every butt pain. It is more of a diagnosis of exclusion, because lumbar disc issues, spinal stenosis, hip joint problems, and other causes can mimic it. So if sitting lights up buttock pain, we adjust sitting, reduce compression, build hip control, and stop yanking the glute into painful end ranges like we are trying to win an argument with it. Bucket 3 is the hip joint, often hip osteoarthritis pattern. This often shows up as groin pain, front of thigh pain, stiffness, reduced range of motion, limping, trouble putting on socks or shoes, or pain getting in and out of the car. Hip joint pain can refer to the thigh, buttock, or even knee, which is why it gets mislabeled as sciatica. Hip arthritis is not fixed by one magic stretch. The best starting point is consistent therapeutic exercise, walking tolerance, gentle motion, and progressive strength. Bucket 4 is lateral hip pain, often gluteal tendinopathy or greater trochanteric pain syndrome. This is pain on the outside of the hip near the bony point. It may hurt lying on that side, climbing stairs, standing with one hip hanging out, crossing legs, hills, or long walks. People often call it bursitis, but persistent lateral hip pain is commonly about tendon load and compression. This is where glute med strength and load management matter. Not aggressive stretching across the body, not sleeping directly on the sore side, not standing like a tired flamingo for 20 minutes. Bucket 5 is low back referral. This is back dominant ache that can refer into the buttock or upper leg, often changing with posture, sitting, bending, lifting, or repeated movements, but without strong neurologic signs. The plan here is calm movement, pacing, hip hinge practice, walking, and building tolerance without poking the bear. Now here is the safe 10-minute starter plan. Minute 0 to 1. Traffic light check. Ask, any red flags? Any new weakness? Are symptoms moving farther down the leg today? Rate pain from 0 to 10 and mark where it is. Back, buttock, groin, side hip, thigh, calf, or foot. The goal is not to feel heroic today. The goal is to wake up tomorrow not regretting today. Minute 1 to 3. Easy walk or gentle march. Walk around the room, hallway, driveway, or kitchen at an easy pace. If walking flares pain, shorten the stride, slow down, or march gently in place. This is not cardio, it is a movement test. Does easy motion calm the system or irritate it? Minute 3 to 5. Hip hinge to wall. Stand about 6 to 10 inches from a wall. Soften the knees. Push the hips back until the butt lightly taps the wall. Stand tall. Do 2 sets of 6 slow reps. This teaches the hips to move without asking the low back to do every job in the company. Minute 5 to 7. Glute med wall press. Stand sideways next to a wall. Gently press the outside of the knee or thigh into the wall while keeping the hips level. Use 30 to 50% effort. Hold 5 seconds. Relax. Repeat 5 times per side. This is especially useful for lateral hip pain because it trains hip stability without big movement or compression. Minute 7 to 8. Bridge or sit to stand. Choose one. For a bridge, lie on your back, knees bent, gently squeeze the glutes, and lift only as high as comfortable. Do 5 to 8 reps. For sit to stand, stand from a chair without letting the knees collapse inward. Do 5 to 8 reps. Hip joint stiffness often likes sit to stand. Back dominant patterns may prefer bridges. Use the one your body votes for. Minute 8 to 9. Optional nerve slider. Only use this if symptoms are nerve-like and the motion feels calming. Sit tall. Slowly straighten the knee while gently moving the ankle, then return. Keep it rhythmic and easy. Do 5 to 10 reps. This should not feel like a hamstring stretch competition. If burning, tingling, numbness, or pain increases or travels farther down the leg, stop. Minute 9 to 10. Recheck. Did symptoms decrease, stay similar, or increase? Did pain move closer to the back or farther down the leg? Does walking feel easier? Your next dose depends on the response, not ego. Now the walking rules. Start with flat ground walking. For sensitive cases, use 5 to 10 minutes once or twice per day instead of one long walk. The session is probably acceptable if symptoms are mild or tolerable during activity, ease afterward, and are not worse that night or the next morning. If pain is intense, keeps rising, or is worse the next day, reduce the dose. For lateral hip pain, avoid hills, stairs, long strides, and slanted sidewalks early. For hip arthritis, shorter walking intervals may work better than one long walk. For nerve-like pain, stop if symptoms keep traveling farther down the leg. Now sitting in car tweaks. Remove the wallet from the back pocket. Use a small lumbar roll if it helps. Keep hips level. Avoid crossing legs. Take micro breaks every 20 to 30 minutes. For car rides, bring the seat close enough that the legs are not reaching. Use a small towel roll if the low back feels better supported. Stop for short walking breaks on longer drives. For lateral hip pain, use a pillow between the knees when side sleeping and avoid standing with the hip hanging out to one side. Now the 2-week progression. Days 1 to 3. Calm and classify. Do the 10-minute plan daily. Walk 5 to 10 minutes if tolerated. Track where symptoms travel. Days 4 to 7. Build repeatability. If symptoms are stable or improving, add 1 extra set to the wall press or sit to stand, or walk 10 to 15 minutes. Week 2. Progress 1 variable only. Add 2 to 5 minutes of walking, or add a little resistance, or add a second strength set. Do not increase walking time, exercise volume, and intensity all at once. At the end of week 2, decide. If symptoms are clearly improving, continue gradual progression. If symptoms are unchanged, worsening, spreading, or causing weakness, get evaluated by a physical therapist or clinician. Sciatica is not the final answer. It is the fire alarm. The smartest plan is not random stretching. It is red flags first, bucket second, low irritation movement third, and progression only when the body says yes. If this helped you sort hip pain, butt pain, or sciatica-like symptoms, tab like, subscribe to Longevity Compass, and check the description for our Amazon KDP book and helpful tools for walking, sitting support, and home exercise. Because the best rehab plan is boring enough to repeat.